go by this. I'll just use this.
Yeah, please. Sorry, I'm a bit rusty.
Good afternoon. Welcome to the City of Toronto COVID-19 media briefing for Friday, June the 19th, 2020. Joining us today is Mayor John Tory and Toronto's Medical Officer of Health, Dr. Eileen Davila. Mayor Tory?
Brad, thank you and good afternoon. Today, the Toronto Police Services Board met and agreed to additional consultation with the public about the Chair's report on confronting anti-black racism. While the report was brought forward to demonstrate the priority that the Board places on getting on with further significant reform, today's decision allows for time to engage in broader consultation with the public and with the Board's own advisory panels. This is the right thing to do, and it is proposed to be dealt with expeditiously. I believe all of this demonstrates that the Board is absolutely committed to reform, to confronting systemic racism, to making sure we are listening to people, and to getting on with the making of changes. The Board will be holding a forum in early July to hear directly from the public on issues related to police accountability, to reform, and to community safety priorities. I am continuing to work with members of the Police Services Board and City Council to make sure that we are doing everything we can to stop anti-black racism and to dismantle systemic racism in our city. I fully support accelerating the pace of change and police reform in Toronto, and I believe the Board was clear today that we are committed to making real, tangible changes which will examine the questions of what police do, what they should be doing and going forward, and how they do it, among many other questions to be asked and answered. Sensible, meaningful policing reform must happen, and I am committed to making sure, with my colleagues, that it does happen. The report tabled today, the public consultation now to take place, and the City Council meeting at the end of the month represent a start to a hugely important process of change and reform, which we're committed to. I'm pleased to announce that the City of Toronto will help Torontonians mark Canada's 153rd birthday virtually on July 1st through a streamed and televised show that we're calling Canada Day 2020. The show will engage local residents, connect diverse communities, and honor our frontline workers. As you know, based on the recommendations of the Medical Officer of Health to stop the spread of COVID-19, we unfortunately had to cancel all of the in-person Canada Day events that we all enjoy so much. I know this was a big disappointment for many people. Fortunately, thanks in part to the Government of Canada, Canada Day 2020 celebrations will bring us together virtually this year. Throughout the day, Canada Day 2020 will be a mixture of live and pre-recorded performances, including, among many others, Julie Black, Gordon Lightfoot, and Ali Hassan. Program details are available at toronto.ca/Canada Day. Canada Day 2020 will also feature Respect TO to honor our frontline workers. I invite residents to nominate their frontline hero at respectto.ca. Nominated names will be broadcast throughout the show as a way of showing our honor for the work they have done supporting and looking after us. And I'm pleased also to announce that the CN Tower will participate in Canada Day 2020 with an extraordinary 15-minute light show that will be live streamed at cntower.ca and set to the music of a diverse group of Canadian artists. I know this will be spectacular for us all to watch wherever we are in the city or across Canada. I encourage Toronto residents to show their spirit and enthusiasm for the upcoming celebrations and for our great country by decorating their porches and their front doors and their balconies or their windows, because I think it is your creativity and your energy that will brighten your whole street, your neighborhood, and our whole city, and truly celebrate this great country that we're fortunate to live in. Canada 2020 is Canada Day 2020 is co-produced by Harbourfront Centre with additional support from TO Live as well as many community and cultural organizations. It is more important than ever, especially after all that we have been through and all that we're going through on a number of different fronts, to unify our community. And I'm pleased that Canada 2020 will bring Torontonians together virtually to enjoy music and entertainment and honour our frontline workers. I encourage everyone to participate in our virtual Canada Day and to help us connect to each other as a city. This Canada Day is unlike any other, but it is no reason not to celebrate and to show our Canadian pride. Today, I'm also happy to announce that the City will resume its in-person marriage license issuance starting on Monday. Summer and fall are popular wedding seasons in Toronto, as we all know. However, we know the weddings themselves will have to look different this year as long as the rules are in place. Many Toronto couples already had to cancel or postpone their wedding plans for this year, and the wedding industry has been hit very hard. The resumption of this service means that couples who wish to get married this year can now plan for their wedding with the confidence they will be able to obtain their marriage license. Last year, some 7,000 marriage licenses were issued between the start of March and early June. This year, with the pandemic upon us, that number has dropped to 421 licenses only issued during the same period, and they were issued on compassionate or urgent grounds over the last 3 months. So we have quite a backlog to deal with as well. Starting today, Toronto residents will be able to book an appointment on the city's website and then complete an online application ahead of the appointment. City staff hope to issue 1,100 to 1,300 marriage licenses per week. Couples with an appointment will be served by special arrangement at the North York Civic Centre. So that's the North York Civic Centre will be by appointment, where couples will be looked after once they've filled out an application. Numerous public health safety measures will be in effect at the North York Civic Centre. All other civic centres and City Hall counters will remain closed for now. It should be noted that many of the requirements for appointments and in-person attendance are as a result of provincial legislative requirements. That is why it is necessary to present yourself in person for one of these appointments. We know that even with this service restarting on Monday, many couples may choose to wait until they can have a ceremony with their loved ones. But for some, love cannot wait. And so for those who want to get married now, we are happy to once again provide this service at the North York Civic Centre. To those couples coming in to get their marriage licenses, I wish you joy and happiness as you begin this chapter of your lives, this new chapter of your lives together. We are making progress every day, and this is further evidence of that, what we're doing with respect to marriage licenses. We're making progress every day in reopening our city and reopening the city government. I listen to our doctor, and you will momentarily have that opportunity, and I really believe we're almost there. Someone once said that patience was bitter, but that the results were sweet. And I feel something sweet coming our way, and I will just say that you deserve it. Because we have been able to make this progress you're going to hear about today thanks to you, the residents of Toronto who have followed public health advice, done all the right things, helped their neighbours who need help, and been so patient throughout this pandemic. I'm proud of how Toronto residents have helped us to fight COVID-19, but I think we have to remind ourselves that the fight is not over yet. We will prevail. There will be a Canada Day, people will get married, and all kinds of other happiness in our future. But we still have to remember to keep up the fight. One final note, may I take this opportunity to wish to all dads and granddads and great-granddads across the city a very happy Father's Day. And I will now ask Dr. Davila to provide her report for the day.
Thank you, Mayor Tory, and good afternoon. Today, there are 54 new COVID-19 infections in Toronto. I'm encouraged to see this number continuing to decline. I'm also pleased to share that to date, 11,611 people have recovered, an increase of 110 since yesterday. As always, for more detailed data on COVID-19 cases in the City of Toronto, I encourage you to please visit our website. We have continued to see a steady decrease in our local COVID-19 cases, and I'm encouraged by this good news, which is the result of your continued efforts. Your continued physical distancing and your diligent hand washing are helping us to move forward. And for this, I am truly grateful to all of you. On another positive note, our COVID-19 monitoring dashboard was updated today, and it shows our 7-day moving average of new cases has hit the goal of 14 days of consecutive decline. With this achievement, the virus spread and containment section of our dashboard has now been updated from a yellow to green status. While the provincial lab testing indicators show improvement, further progress is still needed in this area, and as such, our overall status remains yellow. However, given that we are at goal for 3 out of 4 indicator categories, we should soon be able to join other communities across the province in stage 2 of reopening our city. But our continued progress rests on you and your actions to keep us moving forward. There are many things we can all do to continue building on our progress towards safely moving forward to stage 2. The simplest actions you can take are to continue washing your hands frequently, continue practicing physical distancing, and to stay within your social circle when going out to enjoy the nice weather. This means essentially continuing to follow all of the advice that we have been providing to you over the past several weeks. Another action you can take is to wear a cloth mask. I wear a cloth mask to protect you, and I also strongly encourage you to wear one whenever you are in an indoor public space to protect others around you. So please, when you are at the grocery store, the pharmacy, or taking public transit, please make sure you wear your cloth mask. There's lots of information on cloth masks available on our website, and I encourage you to take a look at that. And finally, as we move towards stage 2 of reopening our city, and more people are mixing and moving around, the last action I'm asking you to take is to keep track of where you are when you are outside your home. Whether it's by using a mobile app like the one announced yesterday, or keeping a log of where you have been by taking photos with your phone with your location settings on, or simply by recording your activities in a daily log or calendar, please take note. Should you be diagnosed with COVID-19, this information will help public health to quickly identify your close contacts and help us work together to stop virus spread and to keep our residents safe. I know that we are all looking forward to getting our city back. At this time, based on our continued improvements on our dashboard indicators, we are clearly moving towards the next phase of reopening. If you're a business owner, operator, or community organization that will reopen or resume service when we reach stage 2, I encourage you to review the guidance documents on our website to prepare your setting. In closing, last but certainly not least, with Father's Day this weekend, I would like to close by wishing Happy Father's Day and offer my sincere thanks to all fathers, fathers-to-be, and father figures in our city. I hope that you enjoy some time with your family and with those in your social circle this weekend. And if you are outside your social circle, please remember to practice physical distancing, and please continue to take care of each other. I'll hand it back to you, Brad.
Okay, thank you, Dr. Davila. Staff on the line for questions reporters may have include Mary Ann Bedard from Shelter Support and Housing and Paul Raftis from Senior Services and Long-Term Care. The first question is to Haley Cooper from News Talk 1010. Go ahead, Haley.
Thank you. My first question is for Dr. Davila. Today, the province announced 3 options for the reopening of schools in September. A full return to class or a continuation of online learning or a hybrid of the two. And it's going to be up to school boards to decide what works best for their region. Is there one of the options that you're leaning towards right now for the Toronto District School Board?
So, Haley, I haven't yet had the opportunity to review that which the province has announced today, but certainly I'm more than happy and prepared, as is the rest of my team, to work with our school boards here in the city to determine what option makes the best sense for their unique circumstances. We certainly have a large number of students. We're the largest school boards certainly in the country, and so there are some unique concerns and circumstances that we need to be mindful of. So I'll look forward to those conversations with our school board partners, and hopefully we'll have something to report to you and others as we go through that work.
Thank you. And my follow-up question is for Mayor Tory. Regarding the actions that we've seen today outside of Toronto Police Headquarters and outside City Hall, where defund the police and abolish the police were painted on College Street and in Nathan Phillips Square, what's the plan for those paintings? Are they going to remain? How quickly is the city going to get rid of them, if the plan is to get rid of them, and what will that look like?
I think that when we have these kinds of protests, and we've had people paint and chalk things at Nathan Phillips Square before, you know, we're not in some big rush to go out and erase them. I respect the passion and the determination of the people who have demonstrated today, as in previous days, and I think the best thing we can do is focus our efforts on making sure that we get on with the consultation as quickly as possible, and that we then get on with making changes as quickly as possible to achieve a significant reform and to address some of the substantive matters that they have raised, which are of real concern to many people across the community, including me.
Okay, thank you. Go next to Raphael Gibet from Radio Canada. Raphael, go ahead, please.
Yeah, my first question is for Mayor Tory and Dr. Davila. With the federal government has approved the NHL's proposal for a core quarantine approach for players entering Canada, that was, if I may say, the biggest hurdle for the City of Toronto to become a hub city in the NHL. How does the City of Toronto now prepare to welcome potentially 12 NHL teams, and how does it affect its plan coming forward? What are the next steps?
Well, I'll just say for our part, and of course Public Health and the Government of Canada, the Government of Ontario have all been involved in these discussions with the different sports. We would welcome any NHL decision to name Toronto as a hub city. And I believe that, you know, in furtherance of the federal government's decision, which is theirs to help with the quarantining rules, that we can create a totally safe, totally welcoming, certainly hockey-focused environment here in the City of Toronto, but that the main objective will, of course, to keep everybody, the players, the staff, and the people of Toronto healthy and safe. And I believe we can do that and put on a great show at the same time. So we'll await the decision of the NHL, and I think it's another example of governments all working together to try to achieve a result that would be positive for Toronto if it comes to pass.
Did you want to add, Dr. Davila?
Yeah, I think the only thing I would add to that is that we've had the opportunity, public health authorities, certainly at the local level and at the other levels of government as well, to review the protocols and proposals as put forward. And to our minds, as long as public health considerations are suitably addressed, which is what we've seen, premised on the documents that we've had the opportunity to look at, we look forward to seeing how the decision is made and look forward to being able to welcome people safely in our city.
And a follow-up for Dr. Davila. With many positive COVID-19 cases surfacing amongst professional teams today, amongst them potentially the Blue Jays in Florida, how much could this trig bubble model of the NHL help avoiding this situation in Toronto?
Well, I think when you look at the models as presented, really what you're looking for is trying to contain people to a circle as much as possible, not dissimilar from what we've got right now with social circles. So when you can contain the environment well, and the proposals that we've seen suggest that that is doable, then I think you contain the risk. And it's all about containing public health risk and ensuring that you have systems in place to address cases as they arise and follow up on them quickly.
Okay, thank you. Next question is to Derek Dionarain from the CBC. Derek, go ahead, please.
Thanks, Brad. This first question is for Mayor Tory and for Dr. Davila. Based on the numbers that we've seen this week and today, how hopeful are you that the province will reopen Toronto, Peel, and Windsor?
I'm very hopeful, and the reason for that is because they're looking at the same numbers we are, and we're looking at the same numbers they are. One of the things we did earlier on was to sort of, base our dashboard on originally provincially originated, factors. And so that dashboard that you see, which has changed in a positive way, is something that was something they as well said they wanted to look at as among the major considerations in making the decision. And so I don't think there's ever been any desire. I've said before, there are no two people that want to see Toronto and Peel opened up more so than Premier Ford and myself. So I think it's always been about those numbers. They're moving in the right direction. So I'm very optimistic we're going to have some, as I said earlier, some sweet news very soon after some of the bitterness that comes from being patient. And I think patience does have its rewards, and I think we'll be better off for having waited a bit of time to make sure we were ready to take the next step, which I think we're almost there.
Yeah, and if I can add to that, I would say that the categories of indicators that we're following here are, just as the mayor said, they are exactly the categories that are laid out in the provincial framework, and all of them are moving in the right direction. Here in Toronto, I've just told you that 3 out of 4 categories of indicator are green, and we're continuing to see improvement across the board, so I'm quite hopeful.
And just to follow up on that, Dr. Davila, how confident are you that reopening these last remaining areas is safe, given that the majority of new cases seem to be originating in Toronto and Peel?
Well, as I've indicated through my remarks, I think that the ability to do this safely rests on all of us. It's us together, our collective actions, and our collective commitment towards public health actions that protect each other and protect our community that will determine our success. So continued hand washing, continued physical distancing, and certainly use of masks in indoor public spaces, staying home when you're sick. These are the important elements that are necessary in order to move us from stage 1 to stage 2, and I would argue from stage 2 to the next stage after that.
Okay, thank you. Next question is to Dave Ryder from the Toronto Star. Dave, go ahead, please.
Hi. First question for Dr. Davila. If the lab testing is the one thing that's kind of holding us back and we're still in a yellow, can you say exactly what we need to see on that dashboard before we're in a position where you're comfortable saying it's time for stage 2 and we can go?
Well, as I've said, it shouldn't hang on any one particular indicator. And as I'm indicating, I think we're moving in the right direction towards stage 2, and I'm quite hopeful that it is not too far in the future for us. So I would like to see some improvement with respect to lab testing, and that is under the provincial purview. And my understanding is that our colleagues at the province are working very hard on that. But I don't see that that should hold us up from stage 2, and we're looking forward to getting to that moment of sweetness after a great deal of patience, as the mayor has indicated.
And follow-up question is, I think for both Dr. Davila and Mayor Tory, is on the issue of masks. We've seen Guelph has now for a few days had a mandatory mask policy for in stores and other closed, confined spaces. And Windsor Essex has adopted a similar policy that's going to go into effect. Why not do that for Toronto if it's going to potentially contain the spread and get us to a full reopening even sooner? What's the harm if it can't hurt to have people say they have to wear cloth masks?
So perhaps I'll start off with that and say that the legal advice that I've received on this question states that while I can strongly recommend the use of masks, that it is outside of my authority to make them mandatory. That being said, my clear advice to the people of Toronto is simply this. When you are in an indoor public space, a grocery store, a pharmacy, another retail shop, or public transit, wear a cloth mask. And please do this to protect others around you. That's the simple advice that I have right now for the people of Toronto.
And I have been very consistent in following the advice of Dr. Davila without exception during the entire pandemic. And I've heard the same legal advice. I have legal training, and I think there is some doubt, at the very least, as to the ability for us here in Toronto, under the Medical Officer of Health's legislative powers, to issue such a blanket order. But I think she has been very clear, I have been very clear, we're trying to set an example as well in saying to people, if you are going to be inside, if you are in any doubt whatsoever, in fact, the best way to sort of stay out of doubt, because I know myself when I've been out and about, you never know when you're going to get into a moment where you can't keep physical distancing, wear a mask. And so I think a lot of people are heeding that advice, and if there's a doubt about the legal authority to issue an order, then what you can do is try to persuade people, which I think the doctor has been doing, and I've been trying to help when I can.
Okay, thank you. Next question is Jeff Gray from the Globe and Mail. Jeff, go ahead, please.
Hi, thanks, Brett. Hi, everybody. I just wanted to ask about the encampment in Moss Park. Does the city have any plans to bring in more hand wash stations or portable toilets, things the activists there have said that there are simply not enough to help the people there?
Yeah, I'll ask Jeff. I'm going to ask Marianne Bedard, who is on the line, to help with that question, please. Marianne?
Hi, Jeff. Thanks for the question. Yes, we're working very closely with our Streets to Homes team that visits that site regularly. We dropped off about 70 cases of water today to make sure that people there are staying hydrated. And we are also continuing to secure space and engaging with people that are staying in Moss Park so that we can move forward and bring them inside and offer them safe space inside.
And do you have a timeline on that, on when you'd be able, when you plan to move folks out of Moss Park and into spaces or housing?
We're working very closely with our interdivisional team across the city to make sure that those plans are in place, and also that we've had an opportunity to engage with people in Moss Park as well. So that'll be coming in the next few days or week.
Okay, thank you, Marianne. Last question is to Lance Hornby from the Toronto Sun. Lance, go ahead, please.
Thank you. For Mayor Tory, though there won't be fans at Scotiabank, obviously, for these games if Toronto is named, what benefits could there be for the city in terms of businesses like hotels and just general morale boosting?
Well, I think it will be a morale boost for us if we were named a hub city because, you know, I believe we're the hockey capital of the world. I've mentioned that at a couple of NHL functions I've gone to, and some of the people from elsewhere take issue with that, but that's their problem. I think we are. I think it'll be great for the psychology of the city. There will be some business for the hotels because, of course, there are multiple teams and their staff members and others who would be coming to the city if that happened. And, you know, I think it will create a lot of interest. And I was saying the other day that whether it's hockey or other sports, if they end up being played in Scotiabank Arena or in the Rogers Centre, it also puts Toronto on the map. Anytime that there's a big sports event coming out of this city on TV, whether there are fans in the stands or not, it's good for the city in terms of promoting it as a place to visit, as a place to work, as a place to live, a place to invest. And so I'm all for that. And so I think there's lots of benefits from it. They're not as great as if you could have, you know, tens of thousands of fans come in, but we'll take the hub city designation if the NHL chooses to pick Toronto.
And a follow-up for you and the doctor, if you don't mind, is it possible that you could confirm that testing for the NHL players could also be available to the public as part of this, part of this agreement with the NHL?
Sorry, I'm not sure I understand the question, Lance.
Okay, I'm sorry. The NHL has said that the public won't be left out, in terms of all the testing that's being done around the rink with the players. Even though the NHL is paying for that, could the public possibly take advantage of those if those extra tests are needed for them?
So I suppose that's something that we would have to discuss in detail with the NHL. I'm not familiar with those particular details of their proposal and what they have in mind, but certainly that would be something interesting to explore.
Thank you.
Okay, thank you, Lance, and thank you, everybody, for joining. That concludes today's briefing. Please have a safe and pleasant weekend, and happy Father's Day, Dad. Thank you.
That was a nice shout out to your dad.
I tried. Yeah, well, that's record time. You get all those questions.
Takes up all the time with the questions, that's right.